the mechanical lithotriptor. We are using this Olympus. It's a B system. Yeah, it's only used for the B scope. Okay, so all you need is this one. This is basically the handle. It's gonna make sense when we open the pocket. Okay, so you just need to make sure that this is working. Yeah, there's actually off and on in there. You can see on and off. Yeah, so if it's off, it moves freely. Okay, when it's on, it do that. Yeah, it's gonna make it like a ratchet. I don't know if you know a ratchet, but that's how it should work. Yeah, so make sure that this is working first before you open the pocket. Yeah, because you're gonna need this one, so it goes hand in hand. Okay, so that's off. I think I need to stop saying okay. So that's off. Okay, I just said okay again. But anyway, that's working. Make sure that this is working first. Okay. Oh, Ibi, stop me saying okay. Yeah, count okay. Yeah, how many times I said okay? So you need to make sure that this is intact when it comes out of the pocket. You make sure that the expiry date is within date. Okay, otherwise you cannot use this. So it comes out of the pocket. You open it up, put it on the side. So usually you have like 3 people in ERCP room, so you can ask your second assistant to help you. You know, you're not alone to do this. Don't think that you're on your own. There's always somebody. So when it comes out of the pocket, there's a black sheet that you need to remove. Okay, so that's how it should come out of the pocket. So there's a lot of things here that you make sure that it's in place. Okay, one is this one. This is it's like a screw that you can use with the hand tight screw. So next, when it comes out of the pocket, you need to pull this. So this is like a stylet that you push in and out, right? So you need to make sure that that's closed. So the rationale behind that is you're sure that your basket is against the white plastic sheet. So basically there's 2 sheets in here. There's 2 sheets. So the plastic and the metal sheet. Okay, so this would make sense later. I'm now sure that the basket is inside. So the next bit is to attach the crushing device, which is this one, right? So what I'm gonna do is I can ask someone to actually hold this. Or if you have a table, put it on the table. Just put it on the table, right? I'm gonna hold this metal stylet, push it in there until you hear that click. It's really faint click. That means that the mechanism here, it catches the metal sheet. Yeah, it catches like that. To secure that, you need to close this. So there's lock and unlock. So you need to twist it clockwise. So to make sure that the stylet or this piece of metal is attached, as you can see here. So it's moving up and down when I do this, right? So you need to align the yellow. There's a yellow marker in here. And then you align it with the mechanical lithotriptor. Okay, so until you hear the click, that means you are ready to go. So that's ready. You need to make sure that when this is set up, the basket is not out, right? So make sure that it's not out. The rationale behind that is probably this is not properly in place. Okay, so you can do that. So make sure that it's, when you finish setting it up, make sure that you can open and close outside the patient, right? So when you're happy that it's opening and it's closing, you can actually turn it on so it won't move. Okay, so when you give it to the doctor, you can, if this is off, you can accidentally maybe push this and it opens the basket. Yeah, so when you put it into on, you're sure that when you give this to the doctor or to the clinician, you are sure that this one is in place. Okay, I'm gonna ask my colleague Evelina to hold. We'll pretend that we have a stone to crush. So where's our stone? So I'm gonna ask the assistance of my colleague. I don't know if she wants to be on the video, but there you go. So we pretend that we go inside. So we hand it to the clinician or to the doctor, but we are confidently sure that this is, so just to make sure that you know what's the function of the off and the on, off and on marker in here. Okay, so when I put it in on, off, sorry, so it moves the basket freely. Just put it, so it's opening and closing the basket freely. Okay, so just make sure that you've done that part, right? So give it to the doctor. So the doctor will put it inside the bile duct to crush the stone. We pretend that that's the stone. So the doctor will ask you open the basket. So make sure that you disengage the ratchet. Okay, otherwise this is the only way of you opening and closing the basket. So basket open. So doctor, please catch the stone. So jiggle, jiggle, jiggle. The doctor will tell you open and close several times until they're happy to close. So until they are happy that the stone is within the basket. Okay, when they said close, and when you feel it has, you know, it's the feeling. It's about feeling that there's resistance or not. Because if it goes through all the way, that means you didn't catch, or the stone is not in the basket. Okay, so that's I've got resistance in here. So you then need to put the ratchet onto on. Okay, so this won't move up and down, right? So when that is done, the clinician is happy, you're happy that the stone is inside the basket. We need to crush. So to do that, we need to put this metal sheet forward. So what you're gonna do is unlock this. So it's just a tiny bit of screws in there, so not much. So you just undo it and move it forward. As you can see here, so the metal sheet will go against the stone. So that's the rationale behind of putting the sheet forward. So it will press against the stone. So when you've done that, you need to say there's a resistance, right? So you need to lock this again. This is screw. Yeah. So when you've done that, that means the stone is against the metal, right? So as you can see here, if you've done that, and the doctor or the clinician said crush the stone, you then gonna turn this knob. Yeah, as you turn it, so basically you're pulling the sheet or the basket inside with the use of this knob. Basically we're using the mechanical lithotriptor because the stone is big, the stone is really hard. So if we fail using the mechanical lithotriptor, the next one it would be EHL. Yeah, but hopefully we will catch the stone and we will hopefully crush it. Okay, so if I turn the knob, it will go straight all the way down here. Yeah, but it doesn't happen all the time. Sometimes the mechanical lithotriptor or the basket will snap and then you're stuck. Okay, but that's how you use the mechanical lithotriptor. We're gonna show you the next on the next video how to use the emergency mechanical lithotriptor, because this mechanical lithotriptor, it doesn't work perfectly all the time. So with anything, there's always a backup, okay? But for now, that's how you use the mechanical lithotriptor. Okay, everybody happy? So for the purpose of this video, I'm gonna open again the basket. So for you to do that, you're gonna put this the ratchet to off. Okay, so you can open the basket. There you go. So the doctor will ask you to close the basket and procedure finished. Okay, thank you very much. I hope that you learned something from this one. If you have any question, put the comment down below.
So how to remove this?
So my colleague said to show you how to remove this. So once it's out of the patient, so you can actually just out of the patient. So press this one. There's a button here that disengage our mechanical lithotriptor basket. Okay, and then you need to unlock in here. So this counterclockwise now. Remember, we did it clockwise to lock, and now clockwise, anti-clockwise, sorry. And then you have to press this button. Yeah, so basically it disengage the mechanism inside it. When you press it, it goes like that. Yeah, which means this is free. All right, so that's it, guys. I hope you learn how to use the mechanical lithotriptor. Okay, so this guys needs a lot of practice. It doesn't happen all the time. So now it's now the time for you to practice. Okay, thank you very much.